Integrating IHS capabilities and competencies as an answer to requirements from combatant commands and others that are planning missions, just linking those communities. But the IHS program is a readiness platform for the future warfight, I'd say. If there was no IHS program and we were in this current situation, what are the different ways that the Air Force would focus on readiness? They've got to build up this uniformed medical service that can go out and do operational missions. I think the IHS program, or big elements of it, would come to development if it didn't already exist. So good thing we've had 20 years of experience.
We can practice our specialty in a portable way and partner with local providers and help the local people, but also really greatly expand our own skill set. Because if you can do something not in a US fancy operating room with all the bells and whistles, but in a bare bones cinder block building with running water and a flashlight, it was just very gratifying and very challenging.
We don't have to spend $1 million to do a surgical procedure. We've shown that with the eyes. They operate on tables in Central and South America on these complex eye procedures at $7 an operation. I mean, that knocks your socks off. We've learned as much as we've given. And a lot of it has to do with a lot of the things we do in the United States as, quote, the standard of care, others can't afford, and they have equally good results.
Exercise is basically the tool to develop and to assess your military medical readiness. So we do that. We utilize Vigorous Warrior also to assess the readiness and medical capacity and capability of partner nation. Our IHS teams have participated in site surveys. So site surveys are pretty important to know what medical capabilities are available in partner nations. So if we were to deploy, our team members would know, okay, what's available in country A or B. So that's a big one with regards to readiness. When we create or certify NATO capability, this creates a capability where we don't have to deploy.
We work closely with our A5I folks, and when they're sitting there and they're like, we need everyone to take a look at these theater campaign objectives, and this is what we're going to base it on. And what they want to see is interoperability. They want to see how are we advancing the readiness mission. So with the PAC Angels, it's not just going in there. And a lot of people, when we go in there, they're like, here's our hospital. This is where you can set up. And we're like, no, that's not what we want. We want you to find a place that we can go and turn into a clinic. And why do we want that? We want that because if there's a national disaster, say your hospital gets taken out, say you can't use it, maybe there's a flood, maybe something occurs and your hospital is not available. We want to show you how to do site surveys. When we go in there, we bring 5-6 cases of stuff. The rest we purchase from that local area because that's what they're going to use. They're not going to wait for the US to come and bring in all high-tech stuff. We need to use what's available in that area. So not only is it getting them to see how to use it and collaborate, but then our folks, my folks who are used to using high-tech everything, are going to go in there and learn very rudimentary ways of caring for their patients. So it really is a collaboration, and everyone walks out of there having learned something